In November of this year, Jacob, Donald Trump will carry this district. Full stop. That is not in dispute. Joe Biden is not going to get 50% of the vote in this district. The only way to send a Democrat to Congress to represent us is someone who can make the appeal for some Trump Huffstetler voters.
Why do you think that you are the candidate that can beat Denver Riggleman?
I believe my service in Afghanistan and Iraq really opens the door to a discussion from a lot of independents in our district. I also believe that being born in North Carolina and growing up in a rural family down there is a huge advantage in some of our big Republican counties. Most people don't know this, Jacob, but Hillary Clinton lost more votes in Franklin County than she won in Charlottesville. So we need to have a candidate that can unite the coalition here of honestly older, whiter Democrats in the South who tend to be a little more conservative, and some of the more progressive folks here in Charlottesville.
One of the biggest issues I've heard a lot of people talking about over the past few years is affordable housing in Charlottesville. And I noticed you have a plan on that. What do you think your plan will do to curb the housing crisis in Charlottesville?
But we want to reform zoning through a competitive grant program at the federal level. We think we can reward municipalities for making good decisions that will improve transportation and housing options for a lot of different folks. So that's the first thing. We want to reform zoning through that project. The second thing, Jacob, is we want to empower stakeholders. And let me give you a couple of examples. The Fair Housing Act actually right now allows for discrimination based on gender identity. We do not agree with that. It needs to be amended. And then finally, we want to make sure that these vouchers are available to families that need them in a time of need. Whether it's in an urban zip code or a rural zip code, we want to make sure that happens. We think these suite of options will really help relieve some of the pressure here in Charlottesville.
What is your healthcare plan and what sets it apart from the other candidates?
It's so important that people working with their hands in our rural communities don't have to worry about whether they can have health insurance or not. So we've got to have that public option on there. We also support caps on costs. We support the negotiation of drug prices, and we support an early Medicare buy-in. The second thing is rural healthcare, Jacob. We've got to make sure that we have providers in our rural communities. I mentioned loan forgiveness earlier. And telemedicine is a big part about how we're going to solve this problem in our rural communities. And we've got to make sure we have the digital infrastructure to do that. The final thing is women's healthcare is healthcare. And as you may know, my wife's an OBGYN. We talk about women's healthcare every single day of our lives. And for me, I just do not understand why it's acceptable for a politician who's a man to get between a woman and her doctor. That makes no sense to me. We would never agree to do that for a man. And so we're gonna fight really hard to make sure women have access and control over their own healthcare and their own reproductive future.
Mm-hmm. And what about healthcare related to the pandemic, things like testing and vaccines?
Testing should be free and applicable widely. A vaccine should, I don't know about the vaccine should be free. I'm assuming it should be. So yes, we should get as much vaccine as possible to as many people as possible, obviously covered under a public option if necessary.
I noticed you're the only candidate that has a plan on the opioid crisis listed. Could you talk about why this issue is important to you and what your plan is to stop it?
You know, I grew up in a house where I wasn't always sure about my own safety, to be honest with you, Jacob. My parents struggled with substance abuse. And my dad passed away from an Oxycontin overdose when he was 49. So this is an issue I understand very well. And I want to try to go and help make a difference in people's lives and make sure this isn't affecting families here in the Fifth. So the first thing we need to do is we need to have emergency intervention here. We need to make sure that every American has access to a compound known as naloxone. What naloxone can do, Jacob, is it can actually reverse the immediate effects of an overdose, and it can save someone's life in real time. We need to have a plan to make sure every emergency response unit in the United States has this available for a call for an overdose. The second thing we need to do is as I mentioned earlier, need to combat this as a disease. We've got to use evidence-based programs for treatment for this disease. I want every healthcare plan in America to have this. It's extremely essential that we treat it that way and that people have access to the care that they need. We need to ensure safe prescription drug practices as well. And then, Jacob, the last thing we need to do is we need to enforce accountability here. Somebody or some group of folks is responsible for engineering the most addictive substance ever created in mankind. And we need to hold them accountable on Capitol Hill. And that's why I have an opioid plan, because this is something that's affected the Huffstetler family directly.